Hello, this is Dr. Ford Brewer, state-of-the-art heart attack and stroke prevention and preventive medicine with access for all. This video is about some of the newer weight loss medications. Obviously, the obesity epidemic has created huge increases in type 2 diabetes, heart attack, stroke, and several other major negative health impacts. I don't run a weight loss clinic. I run a heart attack and stroke prevention clinic. In almost 30 years of practice, I never prescribed a weight loss medication. That was because they were always based on amphetamine-related medications. It's a new day. There are some new options. And in terms of side effects and risks, I'll go back to the last statement. There are non-amphetamine options out there. Several of them are related to anti-addiction medications like naltrexone, which is an anti-addiction medicine for both alcohol and opiates. Several of them have medications related to the SSRIs, the newer, safer antidepressant medications. I've used one of them. It's called Contrave. It has bupropion, which is also known as Welbutrin, and Naltrexone, which I mentioned a minute ago, a medication used for alcohol and narcotic addiction. The intended mechanism is to decrease appetite and decrease the addictive relationship with food. Side effects. One of the known side effects for Welbutrin has been decreased appetite and weight loss. So it's not surprising that they would put it in with naltrexone to try a weight loss pill. The known side effects for Contrave are constipation, dizziness, headache, nausea, and vomiting. The impact of the medication, so far it's shown 5 to 10% loss of body weight per year compared to placebo. That's a good, gentle, steady way to lose weight. There's another medication that's not similar to any of these. It's called Orlistat, or also known as Ally, A-L-L-I. Orlistat works by blocking the enzyme that breaks down fats in your diet. This undigested fat then passes out of your body in the bowel movement. It does not block absorption of calories from sugar or protein, so you still have to restrict your caloric intake. And since it stops digestion of a major portion of your diet, fats, it creates flatulence, gas, sometimes cramping. There are other medications as well, some of them including phentermine, like Qsymia. I have not used any of the phentermine-related medications. What I've used more has to do with my patient population. I see a lot of patients that have diabetes, so I use the GLP-1 antagonists, or the GLP-1 agonists. Byetta was one of the originals. There are others as well, Victoza and Saxenda. Both of those are generic names, liraglutide. Those, again, are primarily anti-diabetes medicines. They decrease the blood sugar by impacting some of the hormones. They're like a hormone called GLP-1, which decreases appetite. Again, bottom line, newer, safer alternatives are out there now for weight loss. The bottom line for my clinic, I'm still not running a weight loss clinic. I'm running a heart attack and stroke prevention clinic. I have less than a half a dozen patients on the diet, the pure diet medications that I mentioned earlier, Contrave and Orlistat. I do have more than that on the diabetic medications, the GLP-1 agonists. Thank you, Dr. Ford Brewer with heart attack and stroke prevention, providing access for all.